Hello, my name is Jared Hammond, and this speech is for Fundamentals of Speech online at Labette Community College. Now, today I'm going to explain why I believe that everyone should have access to universal health care. During this speech, I hope to help the audience to understand some of the differences and also some of the pros and cons of universal healthcare systems. Now, have you or anyone you've known ever limited or decided not to get a medical procedure due to financial reasons? And also, have you ever been put through a financial hardship due to getting a medical procedure during your lifetime? Well, all of us, every single one of us at some time during our life has dealt with a healthcare system. This goes from our birth onwards. So we can see that it is something that really affects all of us. So during this speech, I will define what universal healthcare is and also identify why and also why not it may be beneficial over privatized healthcare. Now, first of all, we have to ask the question, what is universal healthcare and why do we need it? Well, according to the World Health Organization, universal health coverage means that all people have access to the health services they need, when and where they need them, and without financial hardship. This includes the full range of essential health services from health promotion to prevention, treatment, rehabilitation, and palliative care. Now, some of the statistics that are provided by the World Health Organization really show the need for an increased availability of healthcare to the world's population. One of these statistics being that over 930 million people spend at least 10% of their household income on healthcare every year. Also another number being that 100 million people are driven into poverty every year because of out-of-pocket health spending. Also, half of the world's population does not have access to the health coverage that they need. So we see that there really is a need for increased health coverage and availability of healthcare throughout the entire world. So, what examples do we have of universal healthcare systems? Well, two of the ones that might come to mind, especially for us here in the United States, might be Canada, and also we have the example of the United Kingdom. Now, Canada uses what's called a single-payer system version of universal healthcare. This single-payer system is referring in that single-payer being government. So this is where the government pays for the care that's delivered, but all of the hospitals are privately owned, and also all the employees of these hospitals are employed by the hospitals themselves. This is usually funded through taxes, and it's actually similar to a system we have here in the United States, that being Medicare, where the government pays for the coverage, it's funded by the government, but as we know here with Medicare, there is an age limitation, so it's not available to everyone. Now, this single-payer system, it does provide more choice of doctors and hospitals than the socialized version that the United Kingdom uses, but this can also limit what services are covered due to limits in government funding at times. This single-payer system also costs more than a socialized version that the United Kingdom uses. Now, going into this socialized version that the United Kingdom uses, it is similar to a single-payer, except the government runs and pays for the hospital services. So all the hospitals under the system are owned by the government, and also in turn all the employees in these hospitals are essentially government employees and are paid by the government. So this is the most cost-effective system, but in this system, doctors and patients have less choice for treatments that they receive, and also for procedures and treatments that they give. So we contrast these two systems with what we have here in the United States. Here we have examples being private healthcare, such as Blue Cross or any other healthcare system, healthcare company that we would have to essentially shop through. We choose how much coverage we have, really how much we're willing to pay, how much we have to pay for these procedures. It really comes down to how much can you afford, and also what's available to you. Many people only have certain options available, such as through your employer. We also have the public sector, that being Medicare and Medicaid. These are government funded, but they are also age gated, so they're only available to a certain population of the United States. We also have Veterans Affairs, but obviously you have to be a veteran to benefit from this. And it also has an income gate where you can't benefit from it if you make over a certain amount of money. Now, recently we did have the implementation of the Affordable Care Act, also known as Obamacare. Now, this does provide coverage for people that otherwise don't have coverage and can't afford it. People that don't have anything through their employer or anything like that. But this is also income gated, and you cannot have access to this if you make over a certain amount of money. So also, once again, it's not available to everyone. So this leads us to ask, what are some of the pros and cons of universal healthcare systems? Well, some of the pros are that healthcare would be of equal quality and availability regardless of your socioeconomic status. So people, regardless of their ability to pay, whether they be rich or be poor, they would get the same quality, same high quality services, regardless of whether they were otherwise able to pay for it or not. Now, this would especially benefit, obviously, the lower socioeconomic status individuals who would have more access to the care that they need, care that they otherwise might have avoided due to financial reasons. This would also potentially decrease the strain that chronic diseases create on the U.S. and other countries that use non-universal systems. So another pro would be that people would not be put in financial hardship due to needing a costly medical procedure. Now, there's a statistic that I found in a study called The Economic Impact of Obesity in the United States. And in this study, it was found that every year, over $66 billion is lost in productivity just in the U.S. due to obesity. Now, with the universal healthcare system, this would increase the availability for prevention to obesity and also other preventable diseases, and also earlier intervention as well that people might otherwise avoid due to financial reasons. Now, we can also ask, what are some of the cons of a universal healthcare system? Well, especially for someone or a country shifting over from something besides a universal healthcare system, there would be significant upfront costs. This would include governmental changes such as policies, and also infrastructural changes to hospitals, clinics, pharmacies, and outpatient facilities. There would also potentially be an increase in hospital wait times for non-life-threatening illnesses and also elective surgeries, especially in the beginning of the switch. People who would not have otherwise got certain procedures because of financial reasons now have access to these, and there would be essentially a pileup of people trying to get these potentially. But that would ease over time, as examples have shown. There would also be the con of increased taxes. We've got to pay for it somehow. We always hate the idea of increased taxes, but in the long run, studies have shown that this would decrease the financial burden on the country as a whole, and in turn the individual. Now, these taxes would potentially also be more towards higher taxes towards wealthier people as well. Now, these are just some of the pros and some of the cons, and really just a very shallow look at universal healthcare systems and their comparisons. It's a very complex issue, very deep subject, but after considering just some of these benefits and downfalls of universal healthcare systems, are universal healthcare systems a viable option to not only increase health coverage to everyone, but also to decrease the financial burden caused by many other healthcare systems today? Well, during this speech, we defined what universal healthcare is, and also helped to identify why, and also why not, it may be beneficial over privatized healthcare or other systems. Now, although there are pros and cons to both universal and privatized healthcare systems, in the long run, I truly believe that a universal system is better not only for everyone under these systems, but I also believe that it fulfills the basic human right to healthcare for all, regardless of financial status. Thank you.